certainly you're all like me, looking forward to hearing what Dr. Pisonthi has to say. His previous two presentations on COVID have been very, very interesting, and we're all awaiting news to see how Thailand's vaccination program is progressing. And so some of you will have seen the Prime Minister's had his vaccination, and now we're looking forward to that picking up pace within Thailand. So I think on that note, Dr. Pisonthi, can I hand over to you? People could go on to mute, and then we'll take questions at the end. But Dr. Pisonthi, thank you very, very much for giving up your time again, and we look forward to your latest presentation. Thank you.
Thank you. So I will begin.
Yes, please do.
First of all, I need to thank all of you to invite me to come and give a talk again. So my first slide here. This is also another thank you, because last time Mr. Keith Cooper, he asked to come and listen, and then he put this this article into the supplement of the BMJ magazine. So all doctors in England has received this magazine, and this is the content that already said in this talk from last time. So many of my friends, my wife's friends who are all doctors, they just write email or something to say, oh, I see your name here. Thank you, something like that. So thank you for the society to ask me to give this talk. Next one. This is a synopsis of what I'm going to say today. First, how we cope, what is the extent of the Thailand second wave, and how do we cope with that? The vaccination program that you were mentioned about, and about the economy side, how the government help people in Thailand, and lastly, how people in Thailand, how is life here at the moment? How do we live like that? Okay, so about the second wave. This is a copy of the slide from last time that I gave this talk. It's on the November. It's in November. You can see that at that time, we had only 3 cases in a day, on that day. And we have the total number of patients of less than 4,000 people. Now, I will give you the narration of what's happening after that. This is on the date that I already said that we already had very few patients. On that week, in a 7-day average, we had patients of about 6 patients per week. And on the 28th of November, just about 2 weeks time after I gave the talk, something happened. There was a group of people who contracted the disease, and they traced it back to Thai women who went out of Thailand to work in this place. It's called 1G17 Hotel. This is a luxury hotel, and people from Thailand went there. Maybe they can play some, they stay in the casino mostly, and they want to do something there. And some Thai women work there. When they came back to Thailand, they didn't came back on the usual channel, maybe because of the whatever the reason. So they kind of sneaking in. And because that in Myanmar, this hotel is in Myanmar, and we know that we have a lot of cases in Myanmar. So some of the women got the disease there and came back illegally and started to spread the disease to some Thai people. And that cluster happened in the north of Thailand, but it just died down quite quickly. After that, this is a 1G17 hotel. After that, this is the real big one. This is the real second wave. It's in Samut Sakhon. You know, it's the way from Bangkok to Hua Hin. You have to pass Samut Sakhon. Samut Sakhon is the biggest seafood market that the ship from the sea, from the ocean came in, and people from all over Thailand came to that place to buy the seafood, and then they went to the distributed to the restaurant, or they uh, buy and then sell this seafood later on. So there are lots and lots of people coming from everywhere in Thailand to this market. And that is the beginning of the big wave. This is called our second wave. This happened on the 19th of December last year. At the first incident that we knew about the cases, it's been reported that in one day we had 576 people who had the disease. This is quite a big and fearful number for Thai people. But if you compare this number to other countries, it's not that much, but it's still quite scary for Thai people. And you can see in the graph that the number of cases rise up and down and rise up and down until it's happened to the peak on the 1st of February, just last month. We had the number of new cases of 836 people. I don't know if you can see it. I will expand it, okay? Just wait a bit. I will try to expand it. I can see very well here. Sorry, I cannot see the because the Zoom is hiding me. Okay. So, but if you look at the map of Thailand that I put there, you can see that at the very beginning, the disease had spread throughout Thailand. The red zone, the yellow zone, and the orange zone is just spread throughout Thailand. But during several months after that, about 2 months' time, only about 4 or 5 cities or provinces that still had numbers of COVID. This is to tell you that we might have some strategies or something that we have done good to try to be able to contain the disease, not to spread out, and then try to stop the disease quite quickly. As you can look at the graph in the picture, that during this month in March, we don't have many cases as the peak in February. This is the condition of the market in Samut Sakhon, which is quite a standard kind of market that you can see in Thailand. It's something like this. Some of them are not very hygienic. The thing is, usually people are very crowded. And some of them, they do not use the mask properly. And most of the places, there will be some immigrant workers who come in legally, they work in there. And many of them do not follow the guideline that we try to tell them to not speak loudly while you are not wearing mask and try to use the mask properly. But some of them, they don't follow that rules. This is a seafood. That is a thing that people all over the country came to this place. And this is why we need all those workers. Let's say we have shrimps from the ocean. Then you need to be manually peel the shrimp. So these are the workers who came, thousands of them who live there in Samut Sakhon in this area and just spreading the disease very easily. You can see from the next slide that these are the people who work closely to one another. They work long hours. And this is a condition of living This is from BBC News. You can see that they live in a cluster like this, and you can't see, but you can tell from the fact that in such a small room, many people are living together in such a small room. So it's very easy to spread if you have only one case of COVID. And these workers, they are essentially people who are healthy and young. So most of them, they do not have any illness. They are asymptomatic. That is another reason why the disease spread very quickly. So they had to close down the market at one point, and they set up a field hospital like this to be able to accommodate people who got sick or anyone who already had the disease from the PCR test. This is unlike UK. In Thailand, when we see a case, confirmed case, we take them out for quarantine like this in a hospital like this or somewhere in to isolate them from other people. And we ask people whom they know by themselves that they might contract the disease to come and get the test for free. Like this, something like this. And they know that these people not only working in the market, but their friends who live in the same room, they work in the factories around Samut Sakhon, which there are many, many factories there. There are something like 200,000 workers around several factories around there. So they send out people to collect samples. This is called the active case finding. And you will see later on that number of cases that rises every day. Most of them, nearly all of them, are the people that we found because of this active case finding. This is for you to look at the governor of Samut Sakhon. He's in the middle. His name is Mr. Virasak. Because of the thing that happened in Samut Sakhon, so he had to work day and night. He protects himself well. He always wears his mask. Sometimes he stays with the Ministry of Public Health, Mr. Anutin. But one day he got sick and was confirmed that he had COVID disease. Then he had to go to the hospital. This is a sad story at the beginning that we hear things from the hospital from time to time that his condition got worse. Sometimes we hear that he had to have his throat cut, we call tracheostomy, to put the tube in, to put the ventilator in to help his breathing. Another day, we heard about drug resistance in his blood, in his lung. The other day, we heard about his lung condition is very bad, that someone was talking about lung transplantation. So we were very worried and everyone prayed for him. But I don't know why. Maybe because the doctors, they are doing such a great job in the hospital, which is Sirirat Hospital. This is the picture that I want to share with all of you. He is now very well now. He is totally recovered. So on that day that you can see in the picture, it's on the 5th of this month. He got this flower from Grom Somdet Pratep. Everyone here, you know about Pratep. So Pratep gave him this flower to welcome him because he already got better of the disease. This is the good news for us. And this is another one of the thing that happening in Thailand. This is just happened a few days ago. It's called Bangkhae Market. And the picture below, the second one on the bottom, you can see yellow lines, about 6 of them. That means there are several small markets attached to one another that we call together Bangkhae Market. And that market is just about the thing that I show you the picture in Samut Sakhon. In this place, it's been said that the roof, the ceiling was quite low. the ventilation was bad, and no less than 1,000 people will come together and buy things and doing things in this market with the same risk that I already talked about. Most of the vendors, or maybe all of them, are Thai people, but the workers who work there, many or most of them are workers from our neighbor country, and they still doing things or behave themselves like people in Samut Sakhon. They talk loudly. Some of them use the mask, but the mask is below their nose. Some of them not clean their hands properly, something like that. So this is another cluster that happened in Thailand. You can see that on the 10th of March, on the average, we have about 62 cases in 7 days. And just 2 days ago, the average number rises up to 102. So from about less than 4,000 on that date, on the 15th of uh, March, that is the number of accumulated cases in Samut Sakhon only, about nearly 17,000 people. That's the accumulated case because of the cluster or the second wave in Samut Sakhon. But now we are having another one. In Samut Sakhon, things are dying down, but we are having another one in Bangkok. The two pictures on the top of this slide is the message that people around that area. This has been sent from my friend who has a condominium close or nearby Bangkok. This is to tell you that when something happens like this, they will send messages to Line or whatever thing that they can think of to send messages to people who live around that area to know about the incident and tell them that if you've been to that place during this day and this day, you should go and check, and you should look at yourself whether you have any symptoms or not. So this is one of the things that we can control the disease. On the bottom, you can see that when things happen, the Ministry of Public Health, Mr. Anutin, went there, rushed to the place, and then look at the place and see what he can do to control the problem. This is a summary of the things that you might ask why we didn't have cases for so many days and why this had just happened. The first one on the left, that is the camera capture of the woman who came back from 1G1. And you can see that she wasn't wearing a mask. And she walked to see people everywhere. That is a thing that people said, you shouldn't do this. Firstly, you should come back through the proper channel so they can check you, but you sneak in. And then you didn't tell anyone that you had contracted the disease. She didn't know about the disease for herself, but she knew that she might have contracted disease. So she traveled in a small bus. So people gathering in small bus, that's very easy to spread the disease. That is one of the reasons. The second one, that is the Bon. This is Bon. This is a casino. And you all know that casino in Thailand is always illegal. This is one of the reasons, the gambling den, that people came together. And you know, when they stay in these kind of places, they stay for hours, maybe days, and they just not using the mask, and they talk loudly. They do things that you can think of that they can spread the disease very easily. And this is quite a political problem in Thailand because the Minister of Public Health pinned out that some of the small cluster from Samut Sakhon, there is a small cluster in Rayong, and they pointed out that because of this kind of gambling den, So there were quite a story that the the Minister of Interior has been questioned, why do we have this kind of gambling den without knowledge of the police? But this is well known in Thailand. We have this kind of den everywhere in Bangkok and many places. This is a second reason that people who gather in this place, they put the risk to themselves and others because they don't follow the thing that we try to do, like wearing the mask, staying away from other people, wash your hands. They didn't follow any of these. The third picture on the left, on the lower left, is another reason that one incident or more than one, people gathering in a restaurant, usually a round table Chinese kind of restaurant, because they were doing in Thai we call share, share. Share mean one person who wants to get money. They ask people whom he or she knew of and ask for money, something like, let's say, I want each of you to pay me 10,000 baht. And every month we will say which people will get that amount of money with some interest. And the way to gather people to come together and bid for that money, then they put people together in a round table Chinese restaurant like this. So one person might give money to many group of share. So one person from this group share will go to another one, something like this. So this is another reason or the risk that happen in Thailand. And the last one is the bottom that I already said, that this is the situation that you can see that the hygiene is not good, the ventilation is bad, people not wearing proper masks. So these are the things that happen that create the second wave in Thailand. Now, I wish to compare what Thailand has been, the number of people of the second wave comparing to the world. On the left, on this date, we have about 121 million people all over the world who contract the diseases. And in Thailand today, we have 27,000 people. And on the ranking, UK is the fifth in the world, and UK had about 4.2 million cases. In Thailand, we are on the rank of 115, and we have that number that I already said. This is today. We have 248 cases, which is quite alarming because of the cluster in Samut Sakhon. The number was going down and down and down to figure, sometimes just 35, sometimes 60, but now it rises again to 3 figures. But if you look closely, in these 248 cases, only 79 are the people who felt ill or they felt that they had contracted the disease, and went to the hospital or healthcare facilities to get the test. So only 79 are the people who was confirmed to have the disease, who went to the hospital by themselves. But 163 people were the people that we found during our active case finding. And about the death rate, up to today, we had 88 people who died because of COVID. And this is 0.% which is very, very low. We were very lucky that the governor of Samut Sakhon, he did not succumb to the disease. This is maybe because of the good care of the doctors in all hospitals in Thailand that we can save people's life from severe COVID-19. About the vaccine that you all might want to know, this is the thing that we can't compare to the UK. You already had I don't remember, maybe millions of people already had the vaccine. But very few of people in Thailand already got the vaccine. This is the story. Sinovac vaccine is from China, and it has been approved for use on the 22nd of February. It has been approved on the 22nd of February. And 2 days after that, on the 24th, it came to Thailand. The plane landed at Don Mueang, or not, maybe I don't remember, maybe Don Mueang or Suvarnabhumi. And then the vaccine came to Thailand on that day, 2 days after the vaccine has been approved. And everyone was very cheerful to receive the vaccine. This is the first batch that we got nearly 200,000. When you look at the number of doses, you might laugh because this is very few. It wouldn't do anything that is a major change for the scenario of infection in Thailand. But anyway, we got this from China, which came in a quite surprisingly matter because people in Thailand just know one thing, that we were attached to AstraZeneca vaccine because we have a vaccine factory that we will produce them, 26 million of them, and we will have them fine later on. But from China, we didn't hear anything about China at all. Anyway, after the Samut Sakhon outbreak, I thought people in the government talked to the Chinese embassy or whatever, and this batch has been delivered to Thailand without knowing in the first place that how they come along. But anyway, they came. And the cost of the vaccine is about 547 baht per dose. We have to give 2 doses to people. This is a single dose vaccine. When the vaccine arrived in Thailand, there are news all over Thailand that the Prime Minister will be the first person in Thailand who will get the jab. But you knew that it didn't happen. This is why. Okay, the Chinese vaccine is been promised that more will come to the total of 2 million doses in February to April. The reason is on the bottom right of the slide. This vaccine has been approved for people of the age 18 to 59. The Prime Minister, he is 67. So this is the reason that after this, it's been announced that this vaccine is not to be given to the Prime Minister and other cabinets who are 60 years old and over. So that is the first delay of the vaccine to give to people. But Mr. Anutin, who is the Minister of Public Health, he is less than 60 years old, so he got the vaccine. So he's the first person who got the vaccine. So the vaccine of AstraZeneca is a multi-dose. This is just to let you know that there are logistically different between the single dose and the multi-dose vaccine. We don't know what is the cost of the AstraZeneca vaccine. I just only knew about the cost of Sinovac. But looking at the news, usually they say AstraZeneca might cost something like $3 to $4. I don't know what is the exact price for Thai people, but it should be less, much less than the vaccine from China. This is how the vaccine of AstraZeneca works. I think all of you knew this, so I just put in and I will pass it really quickly, unless you want me to tell you. Okay, so continue on from our Prime Minister. After the announcement that he would get the Chinese vaccine, and then we couldn't give him the vaccine. So they said, we are waiting for the paperwork of AstraZeneca. It means that AstraZeneca, that came to Thailand on the same date of the Chinese vaccine. They didn't get the approval from the Thai FDA as yet. So they need some time to get the approval. Finally, they said, Mr. Prayut will get the AstraZeneca shot. The date has been set. The date has been set. And this is Mr. Anutin who got the vaccine on the 28th of February, the first one. And if you look at the people, the doctor on the right who gave the jab to Mr. Anutin, his name is Dr. Yong, Professor Yong. He is a prominent professor. He worked at my university, at Chulalongkorn University. He's a pediatrician. He is the one who will tell people about everything about COVID, especially vaccine. So people in Thailand will listen to him. And he is the one of the reasons why people in Thailand know about the disease, know about how to make themselves safe, know about how to use the vaccine, should they get the vaccine or not, how safe is the vaccine. This is some of the things that been circulating of his knowledge about the things. This is about vaccine. Anyway, after the date that has been set for the first time, it's been delayed. And he said, Mr. Prayut, after the jab or the AstraZeneca vaccine has been approved, he will get the vaccine on March 11. The date has been set. But unfortunately, you all of you knew that on that day, or maybe one day after that, Denmark has announced to stop or cancel the use of AstraZeneca vaccine. And after that, many countries in Europe follow Denmark. So the doctors around Kun Prayut, after brainstorming, gathering information, they said this is unsafe for Kun Prayut to get the vaccine. So they said the date of March 11 will be postponed. Anyway, we didn't postpone the vaccine for long because everyone knew that finally Mr. Prayut already got his vaccine just yesterday in the morning. And because Dr. Yong, Professor Yong, he's old also, he's an elderly also. So he got the same vaccine of Mr. Prayut on the same date. This is to ensure people in Thailand that the vaccine is safe enough, either it's from China or from AstraZeneca. But the truth is, this is, I have to quote my wife. My wife is also a doctor. And she went to a private hospital. And this private hospital is one of the hospitals that is near or the front line against Samut Sakhon. If Samut Sakhon has to come to Bangkok, they have to pass this hospital. So the strategy of the vaccine is to give the hospital in the line of duty that might confront with the disease first. So this hospital has been asked by the government to get the vaccine first for the personnel in the hospital, and also to help the government to ask people to come and get the vaccine. And those people has been assigned by the government. Either they be people who are elderly, but because it is Chinese vaccine, so elderly has been stopped. And the second groups are the people who have a comorbidity, some kind of illnesses like diabetes or things like that. The thing is, at first they said, you should help the government by injecting the vaccine for 500 people a day. But later on, the government said, maybe it's too much. We think you should give the vaccine about 100 people a day. But on the day that people should come for 100 people, my wife told me, only 5 people came. So I think to myself, maybe because people listen to Ajahn Yong, they understand, but maybe they heard things from other sources and they are still afraid of the vaccine. Even though the Prime Minister, Mr. Anutin, Ajahn Yong himself got the vaccine, it's not enough to convince the people in that area. I don't know if I asked another hospital somewhere else, it will be something like this or not. But I heard another story from a student of mine who is a nurse, who is a practitioner. She said, on the time that people ask health personnel in our hospital in Thailand to put their name in, whether they want to get the vaccine or not, she asked me, should I put my name in? Because she was confused and she was afraid. I said, you should, you have to get the vaccine. So she believed me and she put her name in. And she said, Ajahn meant me. All the hospital, only 3 people put in the name, one including me. So even people in the healthcare profession, they were still reluctant to get the vaccine, which is quite unsimilar to people in the UK. I will show you later that people in the UK, from the figure, they welcome the vaccine, not people in Thailand as yet at the moment. This is the certificate. If you get the vaccine in Thailand, we'll give you this certificate. This is how we spread the vaccine. These are the name on the left, the provinces in Thailand. The first one is Samut Sakhon, Bangkok, Pathum Thani, Nonthaburi, Samut Prakan. And the 3 last one are Phuket, Surat Thani, Chiang Mai. So the strategy is any cities that have cases, they will put the vaccine there first. And in the cities, which are the tourist attraction, to welcome people to come back to that area, they will put the vaccine there first. And they will spread the doses, as you can see, for the health personnel, for the people who are not health personnel, but they are the contact people, like policemen or whatever, that they contact the people who might contract the disease, and the health-related issue, and the workers. Workers mean the immigrant workers who work in Thailand. That means even though they came to live in Thailand as a worker, we still give them vaccine for free. So this is the thing that I already said. When you look at the UK in the bottom of the picture, this is the question that asks, I would not take this vaccine and wait until I was offered a different vaccine. And the vaccine in the question is AstraZeneca. You can see that in the UK, the red one is AstraZeneca, the blue one is Pfizer, and the yellow one is Moderna. So you can see that in the UK, people welcome all vaccine. Whatever that the government asks you to go and get, they are willing to get the vaccine, unlike other countries in Europe, as you can see. So I think UK will be in a very good position that you will be getting out of this disaster much better than other countries in Europe. What about the government schemes that help people to live in this crisis of bad, very, very bad economy? On the left is the detail of people who work for the Social Security. They will give these people 4,000 baht, 1,000 baht per month for them to spend. How to spend the money, I will tell you later on. The other one we call โครงการเราชนะ it means we all win. And the first one is about I love Social Security, something like that. And the picture on the bottom, which you say 50 and 50. In Thai, we call คนละครึ่ง. It means that the government will give you some money and you spend half on the cost of the food or thing that were allowed to be in this scheme. So let's talk about the money. 4,000 for the people who work for Social Security. 7,000 for people who are not in this Social Security. And this 7,000 will be given to you something like 1,000 baht per month, per week, until it finishes the 7,000 baht. And they will give you a spread of time, maybe 3 or 4 months to spend all those money. how to spend the money. You cannot spend the money in everything. You have to spend in a way that the government told you to. These are the places that you spend your money. There are places called Thong Fa, something like that. That is the government help, something like 7-Eleven from Thai government to help people in a small community to set up a shop for themselves and sell things in the small community. So you can go and buy anything there, soaps or whatever, tissue paper, whatever in that shop. And also when any shop on the street put the sign half and half, คนละครึ่ง. Let's say this is a place that you can buy some food, some ราดหน้า ผัดไทย, something like that, or ต้มยำ, things like that. If they put the sign here, then you can buy, use your money. If you spend 100 baht, then the government will pay you 50 baht from the money that they gave you. And you can't spend all of your money in one day. There is a limit. I think it's something like 150 baht a day. You can't spend over that. And this sign, it doesn't appear on a big restaurant. The government will check whether this is a small vendor, will look at the tax income, the tax payment or whatever, the income or the money in the bank or whatever, and they decide that this is the small vendors. So they will give this sign to the small vendors, not the big restaurant. And you can spend the money on public transportation or taxi or the whatever to make you travel. So this is how you spend your money. For us, we did not get that 7,000 baht because there is another scheme for people who has to pay a lot of tax in a year. This is called ทบดีมีคืน. It means you will get tax refund for 30,000 baht. And you can use this money to do things. And these things are much more than the 50 and 50 scheme. Like for ourselves, because we had a leakage of the roof of this house, so we asked people to come and replace our roof. It cost us a lot, and we used that receipt that we are going to use that for our tax return this year. So this is a thing that they help us. Another one is called เราเที่ยวด้วยกัน. It means we go and travel together. And this scheme, there are many things that happen to ask people to join and then spend your money to travel, not to stay home. You should go and spend your money. So this is a scheme. The first thing is about you can get 40% off the cost of the hotel room. And some hotel, because there were no crime, so they already reduced the price to more than half already. One of the hotel that we went to is called Kamalaya in Samui. Maybe some of you knew that it is a very, very expensive hotel. Usually, we wouldn't plan our journey to this hotel at all because it's so expensive. But because the hotel already reduced the price 65%, and after that we get another 40% from the government. So we booked that place. I hope maybe in the future they might offer something like this for people in England, especially people in the Anglo-Thai society to come to Thailand and give you this kind of discount. And then the second thing, they will give you money in your electronic pocket, 900 baht per day to spend on food in that restaurant or whatever on the street, 900 baht during Monday to Friday. Saturday to Sunday, only 600 baht. This is to say that people should go and travel on the weekday because usually in the holiday time, in the weekend days, usually they had some customers already. So we should spread the money all of the week, every day in the month. So this is a second benefit. And another thing is the reduce or helping you to pay 3,000 baht off the air ticket. So the following pictures are the places that we've been using this scheme. These are the pictures that you can think of and remind yourself whether you've been to these places already or not, or you haven't been, maybe is a welcome gesture to ask all of you who are listening to come back to Thailand as soon as possible, that you can come. This one, anyone new? Where is this? Anyone? Anyone? This is in the south of Thailand. It's in the water, in the dam. It's called Khao Sok. It's called Khao Sok. If anyone hasn't been there, it's so serene. You should go there sometime if you come to Thailand. This is also Khao Sok. This is also Khao Sok. Okay? This one is Kamalaya. The one on the right, my darling daughter, Surin. She came back to Thailand, spent more than 14 days in the quarantine, per the rule of Thailand. And then after going out, we brought her to Kamalaya. Here is Sirin and me. This is in Ubon Ratchathani. It's in around the area of the so-called Patam. This is Patam. This is the ancient prehistoric painting on the wall of the mountain. This is Dr. Sunetra, my wife, Dr. Sunetra. And this is also in Ubon Ratchathani. This is also in Ubon Ratchathani. Ubon Ratchathani also. So this is about the end of my talk about the life of people in Thailand. After the time that we didn't have cases for so many days, life seemed to came back something like quite normal. People came out, people went to restaurants, people used their life as usual, which already I said last time that this is one of the things that will create another wave of attack. Because when people gather together, and because we are so feeling so well that we didn't have any disease at all. So you are laxing the thing that you already did very good in the past. We have figured that in the past, when things went wrong, people nearly 100% in Thailand were wearing masks. And after that, the number of nearly 100% dropped down from to whatever number. But when people did not fear for the disease, they went out of the track of being safe. So you can see that people went out, and people who were working from home, very few of them now. That's why on the left side of the picture, the traffic jam came back again. This is one of the evidence that Thailand came back to normal now. In the past, when I drove to my hospital, it was so quick. But nowadays, sometimes my wife came home and said, "Oh, the traffic was so bad. I was stuck in traffic for so long." We hadn't heard this for many, many months, but this time the traffic was bad. And people came out. And also, the thing that I already said from the first time I said, one of the good things of this COVID-19 is the pollution in Thailand was very, very less. Now the PM 2.5 has risen again. As you can see, this is the picture taken from quite a few days ago. The bad pollution came back to Thailand again. So this is the last slide to tell you that people want to come to Thailand. So what's the plan for people? They were thinking of shorter the isolation. If you got the vaccine already for 2 shots, you get the certificate, you can come and you can stay in quarantine for just 7 days. And in some quarantine, they already said, you can stay in a so-called resort quarantine. It means this is a big places. And you don't to stay in your room. You can walk around, you can do anything inside of that resort. You can be free, like you are staying in a long stay, 7 days in a hotel or a resort like that. So this is the news to bring to you all, to welcome you all back to Thailand. Thank you. Any questions?
And thank you very much, Dr. Pisonthi. Very interesting update. It was interesting to learn a little bit more about the Prime Minister's jab. I hadn't quite realised the background to that, but I'm just delighted he's had it, and also Dr. Yok has as well, and hopefully that confidence will spread amongst the population, and more people will be having their vaccination. I know some of our members have to go. Joan, I know, has to leave relatively soon. Joan, do you have any questions you'd like to ask, just in case the man arrives at the door?
No, I don't think I do. But very nice to see that at the moment there's only a 7-day quarantine once we've had our second jab. And I shall stay until the phone rings. I've just switched off from silent.
Lovely. I mean, just one thing, Dr. Pisonthi. The Anglo-Thai Society, we have our next regional tour planned in February and March next year, coming to Thailand in March. I'm not saying that you're a betting man, but would you think that that's a tour that we would be able to go ahead and come to Thailand without any quarantine being involved?
I think that is the path that the government want to happen. And I have to add another thing. The slide that I'm giving you, this is a proposal. It hasn't been approved yet. So we have to pass this first step first, where the 7-day quarantine is good for our country. And then they will see whether if you already had the vaccine. And Thailand, by the end of this year, it's been promised that people in Thailand will get enough vaccine for enough number of people. So in that sense, I would guess that if people in Thailand has immunity and people who came in, they already had the vaccine. So I would guess that next year, we can travel quite freely.
Yes, I mean, that's the hope. I think, as you say, we just have to wait and see how things progress. But hopefully that will be the course of action, because we would very much like that tour to go ahead. One other issue which has arisen fairly recently is the situation in Myanmar. Is that causing any concern to the Thai government on the COVID front? Because clearly there'll be more people coming across the border from Myanmar.
I didn't hear about people crossing more to Thailand because of the.
It's good if it's just something I
didn't hear about that. So I think the problem in the borders about the people, immigration, and the disease spreading in that area, we still have some dotted of the area, but it's not a big concern at the moment.
It's not a big concern. No, that's good. It's good to hear that. Anyway, let's open the floor. Has anyone else got any questions for Dr. Pisonthi?
I've got something, Steve, that I'd like to say. If we're able to go and we have our meal at the end of our trip, can we invite Dr. Pisonthi and his wife?
I'd be delighted if Dr. Pisonthi and his wife can join us. No, that would be. We'd love to meet you in person, Dr. Pisonthi. So.
Thank you so much.
We'll let you know those details a little bit nearer the time, but I hope you'll be able to join us so we can thank you in person. No, that's a very good suggestion, Joan. Thank you very much.
Can I ask a question?
Please.
Yes, please.
I'm the director of a small startup, and we are working on sustainable tourism. So that my question is towards that. What do you think is the sentiment in the smaller sort of rural areas? Do you think there is a possibility of slowly reopening for tourism, or is it still a no at this moment in time? I know it's probably difficult to know, but if you have any ideas about this.
It is difficult to tell, because at the moment, the cases are just in a cluster in a big town. It means that people in the rural area, they are protecting themselves from the disease very, very well. And I don't know whether they will welcoming people who they might be afraid of giving them the disease. I don't know, I don't exactly know, but maybe some of the places, they think this is a good way to earn their living and welcoming people that the government has already allowed them to come. So if the government said something to convince people that if we allow these people from abroad to come, that means they are safe for other people. If they can convince that to people in that rural area, I think this is a very good gesture that any people who come to Thailand, please go to visit them, because they live in a very scarce resources nowadays. They didn't have any job. they were living in like some poverty. So as you already knew about.
And also, can I follow on that one? I've heard that they will be opening from the south upwards. So there are some private initiatives for vaccinating people in Phuket and places like that. I think some initiative from the private sector. Do you see that happening? Do you think the
Private
government
sector, yes. Private sector has been set for a while, and the government made the intention that they will allow the private sector to get the vaccine by themselves and give the jab to any people who want to give that private vaccine and pay for themselves. So this is something like 1,000 baht per dose that this had been talking about. So this is the private sector that give. And about the people in the south, this is another problem. I don't know whether you knew about this or not. People in the south, especially the three provinces, they had some idea that vaccination is bad. Not just COVID, especially measles, because we have measles death in small children in these provinces. And I am in one of the committee of the Thailand vaccination program that we were thinking, we were trying to do, how can we convince them to take their children to the center, or we go to their home and give the jab. They refuse to get the vaccine. So this is a problematic thing that if they refuse measles vaccine, I would guess they also refuse COVID-19. So people in the South would be something that we have to how to do that, because we've been trying to do about measles vaccine for years without success.
Thank you very much. That's a very, very interesting information. Thank you.
Any more questions for Dr. Pisonthi? General questions?
Well, I've got a whole list of questions. I'm just going to ask one. Some months ago, there was a lot of publicity about the fact that AstraZeneca had reached an agreement with a Thai company to produce the vaccine in Thailand. But since then, I have not heard anything about it. Has that happened, or will it happen? And if I may just make a comment, I was with my doctor, who is a professor at CMU Medical School. And I asked her how and when I might get a vaccine. And her comment was, don't have it now. We don't know really how well they're going to work. Now, if a doctor's giving that kind of information, I think it's no surprise that we have problems of encouraging people to take the vaccine.
Yeah. Yes, I heard you. And when I was sitting next to a doctor in my hospital in the next room, when patient asked him about the vaccine, he said something like that, not quite like that, but he said something in the way that he did not convince the patient at all to get the vaccine. So this is a problem that a lot of healthcare personnel, even doctors, they didn't have confidence in the vaccine, which is not the same as me and my wife. My wife said every day, when can I get it? When can I get it? She would like to get the vaccine as soon as possible. But about the breach of contract of AstraZeneca and the Thai company, I did not hear about that. And as of today, people in the government still promise that we will deliver the AstraZeneca vaccine from our factory on time and with the same amount of number of vaccine doses as we promised. Yes, June to the end of this year, that they will cover all the population in Thailand. At first they said something like 50%, and now they want to increase it to more than 50% now.
And I can imagine, Dr. Pisonthi, I mean, the chart that you showed, the European chart, I mean, it makes it quite clear that in the UK, people are very happy to have their vaccinations, whichever one it may be. Hopefully the situation in mainland Europe, once that is clarified, because there's a growing number of European countries who are clearly they're having resistance to the Oxford AstraZeneca, the jab. That situation should become much clearer over the next few days. But I can imagine countries like Thailand or people in Thailand are looking at that situation quite closely, because that only sort of hardens up their resistance to having the jab until they believe that everybody else is having it as well. So I very much hope that situation becomes clearer within a matter of, hopefully within a matter of days, because that will I think help people make up their mind to have the vaccination.
Thank you. Hopefully we'll be going like that.
I hope so, because I think that's the key, is that in countries where more and more people have had the vaccination and they see that it's actually working, then that will lead to them being much more comfortable about allowing visitors back into the country. And it's sort of it's stuck in the middle at the moment. People are a bit in limbo. They don't really want to take any firm decisions, and that's not being very helpful. But we'll just have to wait and see how things progress. But your explanation has been extremely helpful. I mean, seeing where the pockets of cases have arisen, how they've arisen, and I think that is the best way to get the information from someone like yourself to see what's actually happening on the ground. I mean, it's very helpful from our perspective. On the economic side, the government is helping people. Is that doing enough? Because the longer this situation goes on, the more it must impact people from an economic point of view.
I would say at least people welcoming the help from the government. I did not hear any complaint about getting those money. They were all very happy to get the money. And I can see in everyday life that they say, oh, I'm going to use half and half for this kway teow, for this noodle, for things like that. So I see it every day, all the time. But anyway, all those money came from the money that we lend. This is the big impact in the future, that how we are going to get the money to return that debt. So this is a thing in the future. But people in Thailand, they are very happy to get the money for free from the government. And I would like to add something, that when wishfully and hopefully you said Thailand will get over this fearful of vaccine in a few days' time. But I have to remind you something. There is a saying in Thailand, maybe you can hear it, maybe you heard about it. It says, "Cha dai pla lem ngam." It means the slower is the better. So everyone in Thailand know about this proverb. "Cha dai pla lem ngam." It means you wait until the end. So if people think like this, I think many people were thinking like this.
Yeah,
they said,
be patient.
I will be the last person to get the vaccine. You go ahead. I will see what happens.
Yes, I think we just have to monitor those. I mean, one thing that has caused difficulties in the UK has been different strains of the virus. Has Thailand picked up any of these different strains? People bringing different types of the virus to Thailand?
Yes, we have all 4 of the strains. The 2 strains of the faster spreading of the disease, and the 2 strains of the resistant to treatment, or the more severe form of illnesses. But this is not a major impact in Thailand about the severity, as you can see from the death rate or mortality rate, that we didn't have that problem as such.
Yes.
But maybe because we got the variant that spread quickly, that may be one of the reasons that's why we have pockets of those and that people who contract the disease.
Yes, no, indeed. Any other questions for Dr. Pisonthi? As I say, it's been a fascinating update as usual. Any more questions?
Graham has his hand up.
Graham, go ahead, please.
Thank you, Steve. Thank you very much, Dr. Pisonthi, for your excellent presentation. You mentioned earlier that a two-step monetary reward for people in Thailand, and you also could I ask you to repeat the part you mentioned in detail, the one about if you earn a certain amount of money upwards? I can remember that one. Could I trouble you to repeat for me the previous one on those on, I believe, a lower income?
About the lower income people who get 7,000 baht?
Yes.
This one is called Rao Chana, we all win. What do you want me to clarify?
Could you summarize what that benefit is and who it applies to? I do apologize.
Oh, okay. Okay, I can give you some example. We have two people who work for us here. One is the cook. The other one is the former nanny of my daughter. Although my daughter is big girl now, she still stay with us. So these are the two people who are eligible for this scheme because they earn certain amount of money that is not much, and they don't even pay tax because the money, the bracket of tax is above their pay grade. So these are the two people that will get their 7,000 baht into their electronic pocket. And my wife helped the two of them to get this because you need to have a mobile phone. You need to have it to be able to get it. And then she spent her money in the usual market that I showed you the picture.
Yes.
Or a truck that brings food to in front of my house from time to time. So in these places, they can spend their money on whatever they want in everyday life. This is the thing that they can spend on.
Okay, thank you very much.
Any other questions before we let Dr. Pisonthi go? If no more hands up, Andrew?
Yes, Peter Bradley.
Peter, go ahead, please.
Thank you, Doctor, for a fantastic talk this morning. It's been a great update. I'm just thinking about the way that the vaccine will roll out in Thailand and how it's rolling out in the UK at the moment. I get my vaccine within the hour, by the way, and I'm very happy to get my vaccine within the hour. But what I'm wondering about is the idea of a vaccine passport. And whilst I know Thailand is ready for people to come and go on holiday, of course, the British government are not ready for that yet. You know, we need to go to a country and then be able to come back to the UK without going into quarantine. So I'm just wondering what your thoughts are on the vaccine passport, which is currently being considered by many countries.
Yes, for us, we are welcoming this. So I haven't thought about the two ways. It's not just us. It's the originating country also that will welcoming you back to the country or not. So I haven't thought about that. Maybe the Thai government has to negotiate with England first, whether this is a reciprocal that we allow people from UK and you allow people from Thailand, whatever. So this is on the government level, I think.
Yeah, it's something at the moment. Countries that traditionally get a lot of British tourists are countries that have mentioned this so far. People like Greece and Spain and Portugal. They're sort of actively promoting this with a view, hopefully before too much longer, that British tourists will be able to return, and hopefully the same will apply to Thailand in due course. But in the interim, I say before we let you go, I very much hope that neither the Prime Minister or Dr. Yong have any adverse reaction to their jabs, because clearly that would not help the situation at all. I hope that all goes well with both of them, and that that will give some more encouragement to everybody else. But hopefully, Dr. Pisonthi, thank you very much again for your third update. Hopefully we won't have to keep calling on too many more updates. I hope perhaps in a couple of months' time we may ask you to give us a fourth update in which the situation will be even more positive than it is at the moment, because Thailand does have an extremely good record in the way that it's handled the situation. But like everyone else, human nature plays a part, and I hope that confidence comes within the country that more people will have the vaccination, because I personally see that as the key to the country opening up again. And until that happens, I think your local proverb will play a very big part. But for today, thank you very, very much indeed. It's been very much appreciated. And as I say, hopefully we look forward to having a fourth update, but in a couple of months' time, and just taking stock of the situation and see where we are, because I think your updates do give us a very good snapshot of where things are in Thailand, and it's extremely very much appreciated. Thank you, Dr. Pisonthi. I think I speak for everyone else to say thank you very much for joining us again. Thank you.
Thank you for having me. Bye-bye.
Thank you, Dr. Pisonthi. Take care.
Indeed.
Thank you.